Okay, this is the heading from The Economist, and it's just an introduction. I've really made this for people in care homes, but it applies to everybody, the first section. And what we need to do is we need to empower the whole dental team, so please sign the petition. We need to get more people able to provide prevention, especially in care homes. So it's a long document and it describes the problem, gives some ideas, but really what can we do? So there are multitudes of mouthwashes out there, but you have the best one. You've had it since you were born. And this is what helps protect your teeth and your gums. And also the tongue keeps everything clean. It isn't a mouthwash that you need, you just need more saliva. But as we get older, the saliva content changes and the amount changes. So this is probably the best thing to keep your mouth moist, and it's probably reasonably affordable. Just remember to swish it in between your teeth, especially as you get older, just to clear out the gaps. So the mouth is full of bacteria and viruses, but generally we just want to keep them healthy. But it will change if we don't keep our mouth clean, and these bacteria then have an adverse effect on us. So as you know, they can go in through your lungs, but also they can go in through the blood system, and that's where we get potentially Alzheimer's, but also potentially heart disease, and also respiratory diseases. And what can we do about it? We just need to keep the mouth a bit cleaner. So we just need to check that we're keeping our mouth clean, which will help with our general health. So you may have had this done when you were younger, but why not do it when you're an adult? It's quite easy just to do it once a month and just move your mouth around and take some photos, and even try out the Smith test. Many of the older generation didn't have aligners or braces. They actually had their teeth out and dentures made, which is a different thing altogether. But aligned teeth are easier to clean. The technology itself may be of value for the older generation. Most of the elderly are on some type of medication, and that generally dries out the mouth. And generally, we would say that the gums mature, and that's where you get some sensitivity. But if you get food caught there, you'll also end up with gum disease, and some of us are extremely prone to that, so we have to be very vigilant in keeping these areas clean, otherwise we're going to lose our teeth. So when we start to lose our manual dexterity, some of these things can help us, but also help the carer. Cleaning someone else's teeth is a lot more difficult than cleaning your own, so we need to use these interdental aids, but you have to use them in the correct manner, and this is what this video is trying to show here. So you have different size brushes for different size gaps, and if we actually have some cameras in a care home, which we could help indicate which toothbrushes we need for different gaps. And I think the brushes with a handle used correctly are probably far easier to use than the smaller interdental brushes that you generally see in the chemist. But they have to be used in the right manner, and I don't think this one's practical. I think you need to approach it from the cheek side. And we should be able to do dry toothbrushing at a time of day that suits the residents. And we can also use this. This silver Diamine Fluoride is being used in other parts of the world successfully, and is 4 times as effective as using a fluoride varnish. It actually stops the disease process. Seniors, it could be applied directly by a nurse, or we could potentially use whitening trays and put in an SDF gel. We know SDF works for tooth decay, and we also know that it's totally safe. There are some indications that it helps for gum disease, but there's no research being done on it of any note, probably because it's too cheap. By signing the petition, you'll help prompt the government to change our outdated 1984 Dental Act. We need something different that empowers the whole dental team in order to provide prevention, which will help all our well-being.